Good day everyone, we are the Group 3 and we are about to discuss the topic classifications of hearing-impaired children and learning disabilities. For learning objectives, at the end of the lesson, we are able to differentiate the classification of hearing-impaired children, identify the common difficulties and features of children with hearing impairment, and describe the factors that could cause a learning disability. Now, let's welcome our first presenter. Happy learning, everyone!
Good day everyone, I'm Maria Catherine L. Ramirez from Bitolet 2A. In this part, I'm going to discuss the topic classification of hearing-impaired children. Hearing is a very important sensation for human beings. It helps to understand the surrounding environment and can alert of any coming danger around us. Hearing is an essential means of communication. Hearing loss is the impairment of the ability to hear sound. The most quiet sound that people can hear are between 25 and 40 decibel. People who suffer from profound hearing loss are deaf and can hear nothing at all. Hearing loss can impact learning and development in children, including speech, language, and affect the overall quality of life. It impacts social interaction and general well-being. The three classifications of hearing loss are: first, sensorineural hearing loss, second, conductive hearing loss, and third, mixed hearing loss. Here is what we should know about each type. First, sensorineural hearing loss. This type of hearing loss occurs when the inner ear or the actual hearing nerve itself becomes damaged. This loss generally occurs when some of the hair cells within the cochlea are damaged. Sensorineural loss is the most common type of hearing loss. It can be a result of aging, exposure to loud noise, injury, disease, certain drugs, or an inherited condition. This type of hearing loss is typically not medically or surgically treatable. However, many people with this type of loss find that hearing aids can be beneficial. Second is conductive hearing loss. This type of hearing loss occurs in the outer or middle ear where sound waves are not able to carry all the way through the inner ear. Sound may be blocked by earwax or a foreign object located in the ear canal. The middle ear space may be impacted with fluid, infection, or a bone abnormality, or the eardrum may have been injured. In some people, conductive hearing loss may be reversed through medical or surgical intervention. Conductive hearing loss is most common in children who may have recurrent ear infections or who insert foreign objects into their ear canal. The last one is mixed hearing loss. Sometimes people can have a combination of both sensorineural and conductive hearing loss. They may have a sensorineural hearing loss and then develop a conductive component in addition. This means that there may be damage in the outer or middle ear and in the inner ear or nerve pathway to the brain. An example would be if you have a hearing loss because you work around loud noises and you have fluid in your middle ear, the two together might make you hearing worse than it would be with only one problem. Hearing loss is common one in every 3 people over the age of 65. A total of 165 million people worldwide live with hearing loss. According to the World Health Organization, this makes hearing loss the second most prevalent issue globally. That's all for my part. Thank you for listening.
Hello everyone, I am Tanya Nicole J. Monilla and I will going to discuss the 8 common features of hearing impairment together with Miss Heidi Gutierrez. So, where does the hearing impairment came from? First, is the speech sound system is delayed and the child is not developing sounds appropriately. delayed expressive or receptive language, autism spectrum disorder, and hearing loss are the most common causes of language processing issue, which means the person who have hearing problem can hear but not that clearly. In short, they can hear but there's uncertain sounds they hear that causes by hearing impairment and sometimes it causes delay. Second one is frequent or reoccurring ear infections. This one is caused by the infections. This is not inborn disability, but it causes of infection. Ear infection are more common in children because their ear tubes are shorter, narrower, and more horizontal than the adults. Chronic ear infections are much less common than acute ear infections. It is also important to go to your doctor or specialist if you notice some problems in your ears to avoid hearing impairment or hearing problem. Third one is a family history of hearing impairment. Hearing loss caused by genes is known as hereditary hearing loss. Hearing loss can be caused by genetics stimulation in a variety of ways. Hearing loss affects some people more than others due to genetic reasons. Their genes expose them to hearing loss as they age or as a result of noise, medicines, or infections. Or in short, nasa lahi or nasa dugo. This hearing impairment is inherited from your loved ones or minana. Then, next is difficulties attending and listening. Imagine this. How can you respond to the information that are given to you if you can't hear clearly those information? So, problems in listening and paying attention to spoken information around us are known as difficulties attending and listening. Adults with attention and listening issues will struggle to respond correctly to the spoken information they are given. So, yun lang po. I will give the four common hearing impairment to Miss Heidi Gutierrez.
Good day everyone, this is Heidi de la Paz Gutierrez and my discussion is the continuation of feature of hearing impairments. Delayed language skills. Hearing loss can influence a child's speech and language development. When a youngster has trouble hearing, the communication part of the brain may not develop properly. This makes communicating and comprehending tough. Performing poorly at school. Untreated hearing loss causes delay in speech and language development, which lead to learner difficulties and in turn poor school performance. Even modes hearing can make it difficult to keep up, yet mild hearing loss is the most difficult to detect and diagnose, since children learn to adjust for their hearing loss at a young age and the milder the hearing loss, the simpler is to adapt, and parents may be unaware that their children can hear but not understand that the way are saying. However, this eventually catches up with them in school. responds to loud, sudden noises. Hyperacusis is a type of hearing loss that make it difficult to cope with ordinary noises. It also known as sound sensitivity or noise sensitivity. Certain noises may appear painfully loud to you if you have it. Even if no one else around you seems to notice, hyperacusis is a kind of hearing loss. However, may perform or person with it also have normal hearing. Poor coordination, balance issues, dizziness, vertigo, and even nausea are the symptoms of inner ear dysfunctions. We may feel a thought we're moving when we aren't. Strain to keep straight or experience motion sickness as a result of standing motionless. All of them are major problems that might limit our capacity to move and sit up. Severe vertigo patients may even feel ill when lying down. Balance issues can be caused by a variety of functions, but a lesser known reality is the hearing loss can cause them. Our ear play a role in more than simply hearing, and the presence of semicircular canals in our ear can cause balance issues in those with hearing loss.
Hello everyone, I am Jasmine J. Trevina from Vitalet 2A, and we are going to talk about common difficulties, often but not always, experienced by the child with a hearing impairment. These are the language and speech delay or disorder, sensory processing, attention and listening difficulties, behavioral difficulties, gross motor difficulties due to middle ear dysfunction affecting balance. Language and speech delay disorder. Hearing sounds and words help children learn to talk and understand. A child with hearing loss misses out on these sounds. This can cause problems with speaking, reading, school success, and social skills. Hearing loss in children can lead to delayed speech and language skills, having problems in school, feeling bad about himself or herself, having trouble making friends, and having difficulties in reading and spelling. In words, children with hearing loss do not learn words as fast as those who have normal hearing. They may learn concrete words like cat, jump, pipe, and red. However, they may have trouble with abstract words like before, equal to, and shy. They may not use words like the, and, are, and, a. Having a trouble knowing the different meanings of a word. Think about the word bat. It can mean a flying animal or what we use to play baseball. A child with hearing loss may not understand these meanings. Fall farther behind children with normal hearing as they get older. Children with hearing loss do not catch up without help. In sentences, children with hearing loss may having a trouble understanding and using sentences. They may understand and use shorter sentences than children with normal hearing. Have problems with more complex sentences. They may not use clauses in their sentences. An example of a clause is when I get home, I will eat dinner. They may not use passive voice. An example of this is the ball was thrown by Mary. Having a trouble hearing word endings like s or ed. They may not understand or use plural words like cats, They may not use past tense like walk, and possessives like bobs with apostrophe s can be hard to hear or use. Speech. In speech, children with hearing loss cannot hear sounds well. They may have problems speaking clearly. They may not use sounds like S, sh, F, T, or K. These are quiet sounds that are hard to hear. Not hear their own voices when they speak. They may be too loud or too soft, too loud or too soft. They may speak in a high pitch or in a low pitch. People may think they mumble or sound different. In school success, children with hearing loss have trouble in school. Reading and math may be the hardest for them. Some facts about hearing loss and school success include children with mild to moderate hearing loss may fall 1 to 4 grade levels behind without help. Children with more severe hearing loss may not learn past the 3rd or 4th grade level. School support will help them do better. Children with a hearing loss do not do as well as children with normal hearing. The gap between the grows over time. Children with hearing loss will do better in school if they get help early. This includes support at home from parents and families. In social skills, hearing loss can make it harder to talk with others. Children may not want to talk or play with other kids. Children with hearing loss may feel alone, like they have no friends, or be unhappy in school. Sensory processing. Children who have either partial or total hearing loss are especially vulnerable to sensory processing disorder. The inner ear affects the sense of balance and gravity, which play a major part in the processing of the other senses. The cochlea also plays an important role in sensory integration. Sensory processing disorders affect both children and adults, causing a misinterpretation of everyday sensory information that others take for granted, including senses related to movement and positioning, though the disorder can affect any number of senses, or all of them at once. It can be particularly daunting when it affects the auditory region of the brain in individuals who already suffer from hearing loss. The severity and nature of the disorder is based on the unique effects it has on the individual. No two people experience the same exact symptoms. Attention and listening difficulties. Attention and listening difficulties. Attention and listening problems are difficulties in listening and paying attention to the spoken information around us. Children with these difficulties may have some of the following characteristics: appears to ignore you, cannot sit still, talks when he or she should be listening, cannot tell you what you have been talking about, does not appear to know what to do when giving instructions, can only concentrate on one thing at a time, is easily distracted, does not settle with one toy but flits from activity to activity. How do these problems affect a child with hearing loss or hearing impairment in school? Unable to sit still and pay attention in a whole class group activities. Unable to listen effectively in the whole class group at carpet time. Unable to follow more than one instruction at a time in class. Child may be easily distracted, affecting ability to work independently. Unable to maintain attention to a task or switch attention between activities. And difficulties in learning and remembering new information.
Good day everyone, my name is Clara C. De La Peña from Bitalan 2A. and I am here to discuss the behavioral difficulties and gross motor skills difficulties. But first, we are going to discuss the behavioral difficulties. What is behavioral difficulties? Behavioral difficulties is a hearing impairment of children shown the significant more proactive aggression, symptoms of psychopathy, attention deficit, hyperactivity disorder, oppositional deficient disorder, and conduct disorder than their normal hearing peers. The loss of the ability to hear has a profound impact on a child's language and behavioral development. Estimates suggest that the children with a hearing problem are more prone to behavioral problems than their normal hearing peers. The challenges of early childhood communication can lead to maladaptive interaction with others that resulting in a behavioral disorders. And according to the research, that problem with language and communication skills are the root of behavioral issues. And now we are going to discuss the gross motor difficulties. Gross motor difficulties due to the middle ear dysfunction affecting balance. Children with gross motor difficulties commonly display in avoidance or general disinterest in physical tasks, rush task performance of physical tasks, too much difficulty or fatigue, silly task performance of physical tasks they find challenging, bossiness in telling others on how to do the physical task or play the game without actively engaging themselves. And how can you tell if your child has a problem with gross motor skills? If your child has a problem with gross motor skills, your child might be late in reaching developmental milestones. Example, sit, crawl, walk, run, and hop. Move stiffly and lacks fluid body movement. Avoid physical activity. Participate in physical activity for only short period. Example is having a low endurance. Cannot maintain an upright posture when sitting on a mat. Be unable to perform the same skills as their peers. Example is catch, kick, hop, and jump. Appear less skillful than their peers in sports. Be unable to follow the multiple step instruction to complete a physical task. Example is obstacle course. Be unable to plan and correctly sequence events or step in a process. Example is step forward before throwing. Fail to perform movements safely. Example is climbing. Need to put in more effort than their peers to complete a task. Pair frequently with physical activity. Lose previously mastered skills if they do not keep practicing them. Be unable to regionalize or transfer a skills. Use the same skills in a different setting or way. Example is can easily change between throwing a big or heavy ball to a light or small ball.
Hello everyone, I'm Jenica Media. For today, we will talk about what teachers should know and how to help the students with hearing impairment. Hearing loss can affect a child's mildly or in a very profound way. Profound hearing loss may mean that a child is deaf. Kids are born with hearing loss and can lose their hearing through injuries, infection, or long exposure to loud noises. There are some signs that a child has hearing loss include limited or unclear speech, not following direction or paying attention, hearing only parts of a conversation, asking for information to be repeated, not being able to hear everyday sounds like a school bell or morning announcements. Hearing loss can be temporary, but when it's not, there are technologies, therapies, and other treatments to help. Devices like aids and cochlear implants that can improve a child's ability to hear. Learning sign language or speech reading can also make it easier to communicate. Here are the 2 easy steps strategies for teaching hearing impairment and deaf students. Look directly at the students and face him or her when communicating or teaching. Say the student's name or signal their attention in some way before speaking. Assign the students a desk near the front of the classroom or where you plan to deliver most of your lectures. Speak naturally and clear. Remember, speaking louder won't help. Do not exaggerate your lip movements, but slowing down a little may help some students. Use facial expressions, gesture, and body language to help convey your message, but don't overdo it. Some communication may be difficult for the hard of hearing to understand. Explicitly teach idioms and explain jokes and sarcasms. Young hearing-impaired children often lag in the development of social graces. Consider teaching specific social skills such as joining into games or conversations, maintaining conversations, and staying on topic.
What is learning disability or LD? A learning disability is a neurological condition which affects the brain's ability to send, receive, process information. A child with learning disability may have difficulties in reading, writing, speaking, listening, understanding mathematical concepts, and with general comprehension. Learning disabilities include a group of disorders such as dyslexia, dyspraxia, dyscalculia, and dysgraphia, and each type of disorders may coexist with another. What causes learning disabilities? Experts say that there is no single or specific cause for learning disabilities. However, there are some factors that could cause a learning disability. Number 1 is heredity. It is observed that a child whose parents have had a learning disability is likely to develop the same disorder. Number 2, illness during and after birth. An illness or injury during or after birth may cause learning disabilities. Other possible factors could be drug or alcohol consumption during pregnancy, physical trauma, poor growth in the uterus, low birth weight, and premature or prolonged labor. Number 3 is comorbidity. Children with learning disabilities are at a higher than average risk for attention problems or disruptive behavior disorder. Up to 25% of children with reading disorder also have ADHD. Conversely, it is estimated that between 15 and 30% of children diagnosed with ADHD have a learning disorder. So what are the signs of learning disabilities? In the normal physiological development, the child is expected to acquire a certain set of basic condition and motor skills. Any significant delay or gap in this development could be a sign of learning disability. A series of well-researched and proven tests and assessments have to be conducted before diagnosing the condition. How is a learning disability identified? Identifying a learning disability is a complex process that the first step is to rule out vision, hearing, and developmental issues that can overshadow the underlying learning disability. Once these tests are completed, a learning disability is identified using psychoeducational assessment, which includes academic achievement, testing along with the measure of intellectual capability. And this helps to determine if there is any significant discrepancy between the child's potential and performance capability or IQ, and the child's academic achievement or school performance. What are the intervention and support options for learning disabilities? A learning disability cannot be cured. However, with timely intervention and support, child with learning disabilities can be successful in school. Parents and teachers are the first person to notice that the child is finding it difficult to read, write, or learn. If you think your child may have a learning disability, seek help from a mental health expert or other trained specialists for the required intervention program or therapy.